For what I raise a garden for, it's the giving and the excitement that people get whenever they come and pick something, or I hand them a bag full of squash or okra, potatoes. It doesn't matter what I give them. Everybody's excited to come to my garden. I started this garden 12 years ago. I started out a few of these tubs at the time, and the first thing you know, I had about 300. And then this last year, I have brought my number up to between 600 and 700 tubs. Just turned out wonderful to give everything away that I'm growing. 2.5 years ago, I had my knees replaced both at the same time, and I never got over the pain for 18 months. The hardest thing when I had so much pain was using the wheelbarrow and the struggle that you endure on your knees whenever you're pulling the water hose. I was hard to live with and dealt with some depression because of the severe pain that I was going through. I just had to get a second opinion to get something resolved on my knees.
The main issue we saw with the implant that was in there was that it had failed behind the kneecap. And when that happens, there's just no way to get comfortable with the knee bent.
I was in lots of pain when I come to see you.
Oh, I could tell. It was very miserable for you. It was this struggle just to walk from the waiting room to the office into one of the exam rooms.
I believe it was getting progressively worse. I think that if I hadn't had the surgery done, that I would probably be on some kind of painkillers and probably be addicted to them by now.
Yeah, I know that it's frustrating from a patient standpoint to be told there's no reason for this pain and you're just gonna have to live with it. And that's very frustrating over the next year, year and a half from surgery.
They did x-rays, and he came into the exam room, and I don't know whether I addressed him, young man, or he addressed me, but his words out of his mouth, "I can fix you." And that was impressive to me. But then the personality, whenever he came in before the surgery, that just said it all.
At Arkansas Surgical Hospital, we really make it very simple for physicians to have access to their patients. And if you have a facility that's used to doing a lot of primary and revision joint replacements, then you're going to have access to expertise from staff and equipment that is readily able to use and people who know how to use it.
I can't express enough to him, and I'll get emotional, but he fixed me like he said he would. And so I'm happy to see him and tell him that the results is wonderful.
That's great. I'm glad to take care of you. It's been really good to see you go through the recovery. It's just a treat to be able to see you get over this quickly, and glad to hear that it's going well. Up until I had my knees fixed this last time, I only had about 1/4 of this garden. I am able to expand it about 3 or 4 times, and I'm very, very comfortable in my body now that I got the relief from Arkansas Surgical Hospital that I got. Dr. Moore was just a perfect match for me and what I want to do in my golden years. I'm very happy about the mobility that I have in my knees, and if Arkansas Surgical Hospital hadn't given me that, I wouldn't have this wonderful garden.